All right, so I don't really want to do any long spiel introduction or anything like that. Again, my name is Dr. Dale Brown. I am a chiropractor. So honestly, what I would say to everybody, just like I said to a congressional committee here in Tennessee when I spoke to them in regards to influenza vaccines, I gave them and read the research, okay? And they asked me who I was and what I did, and I said, I'm a father. That's why I've learned this information. I have nothing personal against vaccinations. All right, I have no injured child. This is simply and solely something that God's placed on my heart. I love this information. I love diving into it. I have a passion. There's a reason I named my son Amos. Amos was the prophet in the Bible that the Lord rose up to show the kingdom of Israel their sinful ways and their idolatries. Okay, when I read that about Amos, the prophet, that's how I decided on the name of my son. And a pastor friend of mine said, Dale, there's no better name than that one right there for your son. So I'm going to give you a crash course. We're going to go through things very, very quickly. If you go to thewilddoc.com, eventually, I think, Anthony, what are we titling it? The crash course and Wild Doc's crash course. And all right, so that'll be the title. And you get all the references here that I get through, okay? This PowerPoint presentation, I've added some things to it for y'all. It took me 3 hours to go through at a seminar for chiropractors, nurse practitioners, and medical doctors. So I've done that for them as well. Again, this is a crash course, and I think just kind of starting off, does anybody know who Edward Jenner is? Supposedly the founder of Vaccinations. Actually, he stole the idea from another individual before that. Again, I'm not too big into history, but he did steal the idea. All right, what was this place called? And I'm going to cover it up real quickly. And anybody who guesses what this place in his backyard where he vaccinated people for free, what was it called? If you can guess it right, we'll get you a candy bar. It's actually like healthier candy, stuff like that. What's that? Anybody got it? All right, I didn't think so. All right, I'll give you more questions to answer later on. It was called the Temple of Vaccinia. All right, the Temple of Vaccinia is where Jenner had a one-room hut in his garden. This is a peer-reviewed medical article discussing the history of vaccinations. So you can get this on PubMed. All right, so the Temple of Vaccinia, so the guy worshiped his invention, okay? What does the term vacca mean? If anybody can guess that, which it's not up there, that'll be, Rachel wanted me to give away stuff, that's why I'm doing it. I'm not big into that. Does anybody know what vacca means?
Cow.
Spanish and Latin. Yep, it's cow. So vaca, nation, a nation following a cow. It's kind of ironic to me. But also, if you wanted to say, this is kind of ironic to me. In 1810, his oldest son died, who he vaccinated, all right, multiple times. Edward, his oldest son died. His name was also Edward, died of tuberculosis. His sister Mary died the same year as his sister Anne. 2 years later, his wife, Catherine, died of tuberculosis. Sorrows overcrowded him and withdrew from the public and life. Now, if you invented something and you used it on all your family members and they all died, would you all be like, I want to do what that guy did? Okay. So I think the most important thing you have to do is understand, because this is what I get all the time. When I start rambling through research and evidence and scientific information on vaccines, what is the argument most people are going to come up with? Well, what about the CDC? What about the FDA? All right? What about these medical universities? What about the vast majority of medical physicians who promote vaccines? All right? I have never sat down with a single medical physician who hasn't admitted to me, when we actually had a polite conversation, all right, hasn't admitted to me that they're like, wow, I've never seen any of this stuff. I've never been given the detail that you can go. I've never seen this research before. We literally strictly go by what the CDC says for us to do. So I think we need to dispel that. We'll go through the FDA first. If you read this, Journal of American Medical Association, that study right there showed that out of 57 published clinical trials that were identified by the Food and Drug Administration to have violations of clinical research, basically parameters. 22 of those trials, that would be 39%, had problems with adverse events reporting. If you don't report adverse events, you can't really tell whether something's safe or not. okay? 14 of those trials, 25, protocol violations, that's research fraud. 42 trials, inadequate record keeping. So if you're doing research on whether something's effective or safe, shouldn't you keep exact records, right? All right. So inadequate record keeping, 35 trials, that's 61%. Failure to protect the safety of patients and oversight for informed consent. And then 30 of the trials, 53%, violations not otherwise categorized, 20, which would be 35%. Only 3 of the publications, okay? 3 of the publications that resulted from trials in which the FDA found significant violations, 3 of 78 publications on PubMed had any mention that the FDA found such things as fraud. Now, if you read through that entire article, the FDA was questioned, why have you not demanded the retraction of all those research studies that were brought about promoting drugs, surgeries, different things like that? Vaccines are not mentioned in this. I will make you all aware of that. They said, we feel that it's our legal liability to protect the identity of manufacturers of these products. But what did you all believe the FDA is supposed to do? Protect who? All of you, right? They admit that they feel it's their duty to protect the identity of criminals. And they did not make medical physicians aware. And that's 78 publications that came about because of fraudulent things, fraudulent research, inaccurate record keeping, all those things. Now, those publications can be used in other publications to promote drugs, to promote the surgeries, things like that. In fact, one researcher actually was found guilty of criminal negligent homicide. He killed a patient because he fraudulently doctored the patient's records to make it appear as if their kidney and liver function was well enough to handle the chemotherapy that he was going to administer. He also selectively put them into the group that he wanted the drug, in my opinion, to look bad. But that's still out there for chemotherapy as a promotion for the chemotherapy agent that his study said was effective, okay? FDA also, this is another example, dengue vaccine caused more harm than good. Sanofi scandal in the Philippines. Sanofi is the manufacturer of the dengue vaccine. Philippines could spread dangerous mistrust of vaccines. They lied. They flat out were found guilty of lying about the fact that if they vaccinated a child before they ever became infected, they would increase the risk of severe dengue fever and death. Children died. I think that would spread mistrust, right? Or I may have skipped ahead, sorry about that. Yes, Sanofi. Then the FDA says it will consider, and these are all in order of years. So it was like 2006, 17, now we're at 2018. The FDA in America considers approval of the dengue vaccine. Do we have dengue fever in the US? And if you take a dengue vaccine before you go and travel somewhere where dengue is there, according to the science that the drug companies had, you will increase your risk of dying from dengue if you get bitten by a mosquito with dengue. But our FDA has now approved it. Philippines revoked it. Dengue researchers faces charges in criminal fiasco. In fact, in the Philippines, a panel of prosecutors concluded that there is probable cause to indict Capeting and 19 others for reckless imprudence, resulting in homicide. They killed children. It especially affected children because they were young enough to where they didn't yet have dengue. Now, they do argue that there's a slight decrease in severity of dengue if they had dengue the first go-around, and it's usually not the first go-around with dengue, it's actually the second time you get bitten. But again, mind you, that is a bite from a mosquito is similar to a vaccine. It's an injection of something. It doesn't go through your mucosal membrane. So when you see and you start reading into research, the way in which you are supposed to come in contact with the majority of vaccine-preventable illnesses, influenza, measles, mumps, rubella, all of these things, HPV in fact, they go through your mucosal membranes, whether it be through the vaginal canal, urinary tract, whether through your mucosal membrane of your sinuses or respiratory tract. That's the way you're supposed to come in contact with these things. It is not supposed to be through an injection. It amounts an altered immune response, all right? And that's the problem. Dengue vaccine gets the nod in the United States. So you think it would get the nod? Do you see how that, and so we'll continue. I almost like thought to myself, like, keep your hand up if you still trust the drug companies. And as I go through this, or the FDA or the CDC, and as soon as you finally have enough information at your fingertips, when you're ready not to trust them, go ahead and take your hand down. But I think your arm wouldn't get too heavy, too tired, because I think we've probably got there already. But Centers for Disease Control and Prevention, Protecting the Private Good. It's a really good article. This is actually in British Medical Journal. They go through multiple examples where the CDC lies to physicians and to the public, all right? The CDC on its own website says it does not take financial money from pharmaceutical industry or industries that have to gain financially from those things, but they have patents on vaccines. Multiple of them. Robert F. Kennedy Jr. has a lot of that information there in children's health defense. But this one, it's very, very telling. Dr. Hoffman of UCLA, he's a professor of medical ethics. That's what he teaches. He said it's outrageous, and the CDC can actually do this. See, a drug industry can give a donation of multiple millions of dollars to the CDC Foundation. So there's a nonprofit, a CDC Foundation, that can receive money from vaccine manufacturers, from drug companies, from implant device makers, all this stuff, okay? They receive the money, but there's stipulations that the drug companies can give them. It's conditional funding. What do we do with conditional funding? If I give you $50, if I give you $2 million and I give it to you on one condition, if you don't hold up to that condition, I can take my money back. This explains how they do that. So basically, the CDC will fund research with the money the vaccine manufacturers give them, and they have to refund the money if they can't produce science that supports safety of their vaccines, safety of their drugs, safety of their chemicals they spray on our foods. All kinds of things were mentioned in this. But Hoffman says, it's outrageous that the industry is apparently allowed to punish the CDC by taking their money back. If the agency conducts research that has the potential to cut into profits, but it is our government that made this very bad arrangement. So the way to fix it is not to ask the CDC, pretty please, be more ethical and avoid conflicts of interest. He says, rather, as a society, we have to get the government to reject the devil's bargain. All right? That's UCLA professor of ethics. Thank God for people like that. But how many of you knew that we need to get our government to reject the devil's bargain? They have placed the lives of our children at lower value than a dollar sign, all right? That is my opinion right there, but I can back it up with research. This is Dr. Paul Thorson. Paul Thorson, this is a direct image screenshot of the OIG Fugitive website. He is a principal coordinator for multiple studies that the CDC uses to say that vaccines don't cause autism. But right here, from approximately 2004 until 2010, Paul Thorson executed a scheme to steal grant money awarded by the CDC, had that grant money to Denmark for researching involving infant disabilities, autism, genetic disorders, fetal alcohol syndrome. The CDC awarded grant funding studies the relationship with autism and exposure to vaccines, the relationship with cerebral palsy, many other things. You guys can go on there and read it yourself. He's an OIG fugitive, okay? Who's heard of Wakefield, Dr. Wakefield? The supposed researcher that committed fraud. He is not an OIG fugitive. He's never broken a law. He's never been indicted. He's never been arrested for breaking the law in research fraud. But this guy the CDC utilizes him in his studies as evidence for vaccines not causing autism, he isn't fugitive. Do you get me? Now, this is something that should frustrate and anger everybody. We have a senior scientist, Dr. William Thompson, who admitted. How many of you know about Dr. William Thompson, the CDC whistleblower? Anybody? William Thompson, the one that confessed that the Mmr Vaccine Study published in 2004 was fraudulent. He gave her 10,000 documents. I've downloaded all of them, haven't read all of them. But it's a lot of emails back and forth. You can even read emails between him and heads of the CDC who basically tell him to cover up things. And in fact, he admits, and this is a C-SPAN video, where Representative Posey of Florida, whose office was handed the documents and legal documents to place, and a lawyer was hired by William Thompson to place him under whistleblower status so that he could not be fired by the CDC. All right? He still works for the CDC. The man confessed that him and his co-authors, and I'll read it to you. If you watch the video, you get a little bit more handle on it. This is something that Mark Green attempted to. Mark Green has gone quiet, and he says, and friends of mine have met with him, and he said, I've been pressured. I'm not forced, I'm sorry. The word was pressured. I've been pressured to put out emails to encourage people to continue on with their vaccines. But he's like, I'm working on it. I'll do what I can. 2015 is when those documents were handed over to Congress. 2015, July, was when Representative Posey read that to our Congress members in Washington, D.C. And nobody has said, I want to know the truth. You get me? Mark Green was called a quack, an anti-vaxxer by the health department of Tennessee when he said, I have constituents of mine who want to see what William Thompson has to say. That's basically what Mark Green said. Does anybody here want to see what a man confessing a fraud has to say about what we're doing to our children? Do you get me? Why don't our Congress members? As you can see, this is one of the most, to me, it burns me. Just seek the truth. If you are a Christian, how in the world can you claim to be a Christian but be okay with not doing anything to request the truth, to have him subpoenaed by Congress, to have a worldwide, national, televised investigation into a man who confesses to fraud? If I confess to murder today, without any speck of solid physical evidence, I could be arrested and taken to jail and never released. And somehow I proved that I lied about my confession. Do you get me? If I said I killed so-and-so who wound up dead. This man is confessing. The CDC has been covering this up. He literally says that the remaining 4 co-authors all met, brought a big garbage can into the meeting room, reviewed, and went through all hard copy documents that we thought we should discard and put them in a large garbage can. That is the CDC's way of doing research when it involves the safety and lives of our children. Julie Gerberding, the head of the CDC at that time in 2004, for which that research fraud was taking place, went to work for Merck. Merck is the maker of the only MMR vaccine offered in the United States. So the head of the CDC went to work for Merck, whose vaccine was protected. You get me? You want to see additional lawsuits, you can go to ICANN, all right, and lawsuits. Informed Consent Action Network, and you see multiple different lawsuits that have been filed against the CDC, the NIH, and different government organizations that prove that they cannot say what they're trying to say about the safety of vaccines. This is another individual, this is Dr. Gary Goldman, who also a consultant with the CDC. He said that they manipulated and concealed unwanted outcomes of shingles and chickenpox vaccines. Okay, chickenpox vaccines go up, shingles rates go up. All right, 300% increase, I believe it was. Don't quote me on the 300%, but go and read it. Increased cases of shingles, and the I raises key questions. And if you look at, usually, do you all remember back in the day when they'd be like, shingles kind of typically occurs through this dermatome around T12. Now it's occurring all over people's bodies and in their eye sockets, making them go blind. These are non-typical symptomatic appearances or expressions of shingles. This wasn't seen to the degree it was. This is being seen where before, when we didn't do a shingles vaccine, when we didn't do a chickenpox vaccine, we weren't seeing this. All right? And shingles is far worse than chickenpox. And I will say that there was just shy of, I believe, 200 on average children that could succumb to severe chickenpox and die. All right? I'm in no way saying that these illnesses can't be, for the susceptible, potentially harmful and deadly. Do you follow me? But why don't we focus on the things, and I'll show you in a little while, the rates of the decline of the mortality prior to vaccines being available. Vaccines do not cause autism. That's what they say. If you go to the Institute of Medicine's report right here, this is a link on the CDC's website. If you go to that, it's 895 pages. They say that vaccines are very safe. If you read the entire report, which is right here, all right, it's 895 pages, mind you, but you will find this in there, all right? These are things I've read. So what I tell people is, again, I'm a father and a person who, this is my hobby. I go hunting and I read vaccine research in the hunting state. That's kind of the way I do it. I even have this is not a Bible, but this is jokingly called the Bible of Vaccines. All right? Stanley Plotkin, who wrote this, is called the Godfather of Vaccinations. There's a lot of religical references when they talk about vaccines, if you start to dive into it. All right? This is not a Bible. This is nobody's Bible, all right? But this, I haven't read all of it. I've actually just kind of jumped in and out of it periodically. It's kind of like on my shelf to read, reading this. These are medical textbooks. This is not required in medical school. This is not required in medical school, all right? But vaccines and autoimmunity, you can find plenty of evidence showing that they know for a fact vaccines do initiate autoimmune antibodies in the blood and bodies of individuals. They distort your immune system. They know that for a fact. They use the tetanus toxoid to initiate in rats autoimmune conditions for which then they can study their drugs to see if they can cure your autoimmune condition or suppress your immune system enough to where it doesn't attack your tissues anymore. They use ingredients in vaccines to cause autoimmune conditions. Just think about that. All right, but here we go. So again, going back to this, I'm sorry about jumping around. Again, they said what? Vaccines are very safe. That's what the CDC's website says. When referencing this report, this is the report. Here's the information and conclusion synopsis. Some might interpret that to mean that either of the following statements. Because the committee did not find convincing evidence that the vaccine does cause the adverse event, they studied 150 some adverse events. Some they showed causal relationships, some they proved and said that they had proof that there was not a causal relationship. But 135, they said there was inadequate evidence to say that the vaccine caused or did not cause that adverse event. But so, because the committee did not find convincing evidence that the vaccine does cause the adverse event, the vaccine is safe. We didn't find evidence. Well, if you never looked for it, you're not going to find it. Do you follow me? All right? Because the committee did not find convincing evidence that the vaccine does not cause the adverse event, the vaccine is unsafe. All right? Neither of these interpretations are correct. So a government report that the CDC used to say vaccines are very safe said you cannot interpret that report in that manner. Do you get me? The CDC lies to you. Is that not a lie, or am I just like over-exaggerating my opinion? All right, if anybody call me out, please, if you're like, no, doc, you're a liar. That's actually a good interpretation of that when they say you don't have it. Yeah. Another interpretation here, another government report. This one was like 285 or 300 and some pages. That was sitting in the hammock for an entire day reading this one. So, childhood immunization schedule is considered one of the most effective and safe public health interventions available to prevent serious disease and death. Furthermore, the committee's review of the literature did not find high-quality evidence supporting safety. We considered it one of the most safe and effective medical strategies, right? But we didn't find convincing evidence that there was safety. Do y'all want to read that again? Do I need to read it again? That's our government for you, folks. Long-term effects of the cumulative number of vaccines or other aspects of the immunization schedule have not been conducted. That's their admission, all right? Now, yeah, the fraud goes even deeper. FDA, CDC, we know the vaccine manufacturers, drug companies. This is a court case going on. This is a legal document from the Hazelhurst. I believe it's Hazelhurst. Yeah, I'm sorry, I'm kind of missing on the name. But so one of the children that suffered autism following vaccinations, his father is a prosecuting attorney for the Attorney General in the state of Tennessee, all right? This guy is legit, all right? All right? So his court documents, they subpoenaed Dr. Andrew Zimmerman, MD, who was utilized by the Department of Justice, okay? This is just antibiotics cause mitochondrial distortion and mitochondrial damage. The child was on an antibiotic when he was given the DTaP vaccine, and mitochondrial dysfunction has been shown to be a risk factor in the development of vaccine injury or autism. But in the court case, this is the exact words, this was an expert witness by the Department of Justice to attempt to say vaccines don't cause autism or to evaluate case by cases, all right? Dr. Zimmerman says this, in my opinion, it was highly misleading that the Department of Justice for the Department of Justice to continue to use my original written expert opinion as to Michelle Cedillo as an evidence against the remaining petitioners of the omnibus autism proceeding. That's what OAP means. In light of the above referenced information, which I explained to the DOJ attorneys, while omitting the caveat regarding exceptions in which the vaccinations could cause autism. He was supposed to be there in person. He got a phone call roughly 2 or 3 days after he met with the attorneys for the Department of Justice, where he said the next case, I am going to admit this child's vaccine injury, or this child's autism was caused by a vaccine injury. The case prior, a little girl, he testified that her autism was not caused by the vaccine. There are multiple causes of autism, okay? So one case did not. They already awarded Hannah Pulling, which they shielded her information and excluded her from the 6 cases that were supposed to represent roughly 5,400 families at that moment in time. They took his written testimony, cut and spliced it, and explains it, all of this in this legal document. The Department of Justice is even corrupt, all right? Now, I've had literally people say, well, here's the thing, Dale. Government officials and different people like that. Well, here's the thing you got to think about. If they admitted it, it would bankrupt our nation. I don't care. Families, do you know how much money it costs to take care of an autistic child for their entire life? Tens of millions of dollars sometimes. Minimally, $1 million for like the lower level autism. It's sad. Watch this. This was surfing the web for U.S. Court of Federal Claims. Let's look at what the court awards to families when their children are vaccine injured. This child, interesting enough, was in the omnibus autism proceedings, but he exited. The petitioner filed a notice proceeding separately from the OAP. Why? Because the vaccine, the DTaP vaccine that caused his autistic features, his autism, he was in the autism honors proceeding, which that Dr. Zimmerman's testimony was fraudulently used to say that vaccines don't cause autism, and then they ended up after, I think it was like the 6 cases, and excluding Hannah Pullis, excluding another one where they awarded for autism. And they have like 80 some, I think, cases where it's autism was one of the child's diagnosis, but as long as they left it off the reasons they're filing a lawsuit, then they could get awarded money. As long as you left it off and didn't file a lawsuit for autism, some of these parents have been getting awarded money. This child exited that because the child died from his neurological injuries, and they awarded the family over $1 million. So he was part of the autism omnibus proceedings. Fraudulent testimony was used, or testimony fraudulently cut and spliced, was used to exclude all of those, kick them all out, not award the families any money. All right? This child, just the pop into my head was like, was this family lucky enough that their child died before they kicked him out and didn't give him any money? If that child hadn't died, would have never got a dime. You get me? That is, when I saw that and read that in U.S. Court of Federal Claims, I'm sitting there, I'm literally like, God, how in the world, how ironic is that? And out of thousands of court documents, I find that one. Frequently asked questions, do vaccines cause mitochondrial dysfunction? Well, according to the Hepatitis B vaccine, induces atopic death in your hepatic cells. That's your hepatitis, what is it? Your liver, all right? And it can cause loss of mitochondrial integrity by the Hepatitis B vaccine. Is Big Pharma addicted to fraud? If you read that, there's court documents where doctors are bought prostitutes to incentivize them to sell their medications to you all. What the drug companies are willing to do to sell their drugs is completely demonic. And right now, in this day and age, I wouldn't put it past them to be buying children. Do you get me? They have been found guilty of buying prostitutes and incentivizing doctors with money, sex, all kinds of things to sell drugs to people. Do you want to fund that organization? If you found out I did that, would you ever come and eat at my ice cream parlor, at my restaurant, or anything else if I did something that terrible? Nobody would. Now, if you're on a medication, please don't run out of here right now and just say, I've got blood pressure that spikes to 300 plus, and if I don't have my med, but I cannot stand to give money to the pharmaceutical company, don't just throw it away and then have a stroke and blame it on me, all right? But do all you can to get healthy, stay healthy, please. So I will give a shout out to Dr. Ronson. People like myself, one of the things I want to do for people is if I can help them get healthy enough to where they don't need their medications, well, then we're stopping funding the beast, in my opinion. And it's not necessarily that I'm saying they're the biblical beast or anything like that, but FDA additional information, if you look at Avandia was killing people. They saw that in the pre-FDA studies that withheld that evidence from the FDA when they got it approved. Did you know that the FDA cannot require the drug industry to actually hand them all the data? They get to selectively hand data. Now, even though Avandia was taken off the market after they found that it had an increased risk of cardiovascular disease death in diabetics, the FDA then helped in funding Duke to back findings from controversial Avandia study. Duke University had to pay a $112.5 million settlement for faked research. That's not the Avandia research, but they do fake research, okay? They attempted to say that the drug was not as deadly. It's not on the market, they're not putting it back on the market, but because the FDA assisted, I did a video on this specific issue. They assisted in the cover-up. The FDA did that. So to basically cover their rear ends, the FDA paid Duke and allowed Avandia's manufacturer, the drug company, to decide what information Duke University was allowed to look at to say that the drug was safe or deadly. And Duke University, again, came back. We looked at the information that the manufacturer of Avandia was willing to give us, and we don't think that it actually increased the risk of cardiovascular events and disease. Why did the FDA help fund it? Why did they allow the drug company to conceal information and not give it all to, It's pretty simple when you dive into this stuff. Fierce Pharma, systematic data fabrication, and Chinese police seek to arrest 18 in vaccine scandal. I'm not gonna read it, it's just Introduction to Institutional Corruption and Pharmaceutical Policy. Really good read if you wanna really dive in and down that rabbit hole. It's unreal. This is Chatham versus Merck, which has now been finalized, and it's under seal. All right, they used rabbit blood. They lied about the numbers. 2 of their own researchers came forward and alerted the FDA. Merck, in fact, threatened those 2 researchers, saying, we'll get the police to arrest you and put you in jail if you go to the FDA one more time and tell them that we're committing fraud. The FDA did an investigation, talked to the other ones, weren't allowed to talk to those 2 researchers for some reason, but they did file a lawsuit. Come to find out, it's been sealed, all right? It can be sealed. Who gets to decide whether it gets sealed or not, though? Here's an interesting matter of fact. So it's been finalized. Who's the crime been committed against? When they used rabbit blood in the MMR vaccine effectiveness study, specifically to the mumps portion, all right? That crime's been committed against anybody who's ever accepted that vaccine. Do you get me? Those 2 researchers have been awarded money, I guarantee it. Those 2 researchers who confessed and went to the FDA saying that Merck is committing fraud, all right? That took over, I believe, 11 or 12 years to finalize in court. Those 2 researchers get the decision on whether they want to make the information public or if they want to keep it private. And if they get awarded money, and Merck says to them, this can happen. I've talked to judges. Well, hey, would you keep it silent? I'll give you an extra $2 million if you'll keep that under seal. So according to, sign that legal document, we'll pay you extra money if you'll keep this under seal, because you're the one who gets to decide whether you tell on me and tell the people who the crime's been committed against what we did. Is that not shameful? That's our government. HIV researcher found guilty of misconduct, sentenced to prison. Oh, he used rabbit blood, just like they did in the mumps vaccine. And those are the 2 times we found out about it. Do you get me? Sorry, I like to say get me, but HIV vaccine trial teaches us lessons that placebo-controlled trials are important. That's according to Dr. Fauci, who recently said, we can't do a placebo-controlled trial on the coronavirus vaccine. You can find video of him saying we don't want to do a placebo-controlled trial on the coronavirus vaccine. But he says in here, the vaccine looked effective, until we matched it up against the placebo. Then we found out that those who received the vaccine were actually worse off. So he said it's important to have a placebo in a vaccine trial to actually prove that it's effective and safe. But then he comes out now and says that, so you see, they'll talk about both sides of their mouth. It's vax versus unvax. If you look at the DTP, this is not the DTaP. The acellular pertussis is used in the United States right now. The whole cell pertussis vaccine was used. It killed so many children. It caused neurological damage. And you've actually find 1977, there was a published in the Lancet, showed that it caused severe neurological defect. That's what the DTP vaccine caused. Because of the number of lawsuits where we could back then actually sue the manufacturers of the vaccines until the 1986 Vaccine Injury Compensation Program was introduced. We'd sue them and they were basically going to go bankrupt. They couldn't keep their product on the market, so they begged and pleaded governments to shield them from any liability. DTP vaccine causes an increase. Every study, including World Health Organization studies, they just sit there and give an excuse. Well, we just don't understand why it's occurring, but we do see that there's an increase in overall mortality. In one group, it was actually in Guinea-Bissau, it was roughly, I think, 10 times the overall mortality. But guess what? It does reduce the risk of whooping cough diagnosis, not of transmission or infection, according to FDA studies. But at 10 times the mortality. What I tell people, it's pretty simple to make something look good when you don't actually measure overall mortality rates. Placebo-controlled trials done in Africa, funded by the Gates Foundation. I did a video, you can watch that later. They showed that children who were birthed by mothers who received the influenza vaccine while pregnant, more of the children died. More were born with brain damage, more were spontaneously aborted, all these things. That's a placebo-controlled trial, and they've done, I believe, 2 or 3 of those in Africa. Why do they happen in Africa? A lot of these places they do them haven't got any internet access, folks. There's reasons they do that. But they do not have any evidence that a DTP vaccine improves survival in any way. Are well child visits a risk factor in subsequent influenza illness? 700,000 cases, they estimate, of influenza-like illness are caused from well baby checkups. Effectiveness of trivalent inactivated influenza vaccine in hospitalized children, again, unvaccinated better off. In school-based, no vaccines, we give all these children in this school vaccines, more people at home sick, more children missed school days, all this. But if you actually read that research, if you use the abstract, they say the opposite. But when you actually read it, you'll see that they, in their conclusions where you got to pay for this, it says more people were sick, more children missed school days, increased risk or use of drugs, medications to treat fever and things like that. But they say, we found that influenza vaccine was effective. And basically all they said in this abstract. And that's what you get for free on PubMed. So you actually have to buy it to verify what I'm saying. All right, increased risk of non-influenza respiratory viruses such as coronavirus, rhinovirus, Coxsackie virus, things like that. In children, you have an increased risk of other respiratory illnesses if a child is vaccinated over an unvaccinated child. Another study published in 2018, assessment, this is funded in part by the Centers for Disease Control and Prevention. Among the children, there was an increase in hazards of acute respiratory illness caused by non-influenza respiratory pathogens post-influenza vaccination compared to unvaccinated children. So your children will have less respiratory illness if they're not vaccinated, according to CDC scientific studies. When you look at vaccinated versus unvaccinated study, see the way they show vaccine effectiveness, I don't know if I want to go into it because it's kind of a little bit of an explanation. Sometimes I get tongue-tangled when I'm trying to explain it. Basically, when you go into a hospital and they do these observational studies and they look at people who are coming in with influenza, let's say you get 100 people coming in with influenza-like illness, and out of those 100, they were all vaccinated. And okay, well, we got 5% of those people were diagnosed with influenza. That's only 5%. But then in the unvaccinated group, only 50 people came in, but 20 of them were diagnosed with influenza. Statistically, this is a higher percentage of the people who are unvaccinated had influenza. So it reduced the rate of influenza diagnosis. It didn't reduce the rate of hospitalization. That is how they deceive people. You have to read these research studies. I did an entire video on influenza, and that's another 100-some slides, all right? And again, the reason I can do this type of information, this talk, I am not a medical physician. This is not medical advice. This is just running you through research and giving you the links to read it yourself. You make the decision for yourself. Do not take my opinion. Do not take my word, anything I say, as telling you not to vaccinate your children. You need to make an informed decision on your own, and you need to realize who you are trusting. And trust me on this, there are really good doctors, really good medical physicians with good hearts, sincere hearts, that would love to protect your children, that want to protect your children. But just like I showed you, if the FDA won't give them information about fraud, how is your doctor ever making a good decision? When the CDC lies to them, when the CDC covers up, when Congress won't investigate confessions of fraud, how does your medical physician ever do what's right for you and your family? You follow me? They have destroyed the ability for medical doctors to do their best for their patients. And that is wrong in itself as well. But the best weapon, I believe, that's been wielded against our children in this nation and across the world is the love of a mother. I see mainly women here. The love you have to do whatever you can to protect your children. How many of you may or may not, you may be the few. How many of you are actually going to take the time to read all 895 pages of that government document? How many of you think that a pregnant woman right now watches this and says, okay, I got to verify all this information? It's going to be really hard to go through all this information and weed through this. This has been my quote-unquote part of my life's work. All right, and the other three beautiful kids that were running around over there, the blonde ones, curly hair. Somehow my son got straight hair. Still question mom on that. Nah. Higher mortality in rhinovirus. Do you know that rhinovirus is the #1 cause of pneumonia over influenza, and especially during the summer months? If they're assuming coronavirus cases according to respiratory illness, I can show you multiple studies that show that bilateral ground glass opacities, dual pneumonia in the lower lobes can be caused by rhinovirus and is caused in 50-year-old people. One case was a 52-year-old woman, drank a glass of wine every single night. They blamed immune deficiency on a glass of wine and alcohol, which could, yes, cause immune deficiency, probably sure some other things, but it just shows you. But rhinovirus was one of the highest increased infections in children if they received the influenza vaccine, and it's more associated with pneumonia. It makes up about 50% of the yearly respiratory illnesses. Coronaviruses, a class of viruses, like influenza is a class of viruses. You get H1N1, H3N2, all those things, A and B. We didn't classify coronaviruses like that, but coronavirus is a class of viruses. It made up about 25% of the annual respiratory illnesses prior to this year. And ironically, the studies were done in New York to see how many people would walk around, and roughly 6% of people walking into an amusement park were infected with coronaviruses. And our current coronavirus PCR testing cannot identify the differences between all of these. If they have enough genetic material similar, it will come positive on PCR test. And again, off topic, but PCR tests were admitted by one lab to have a 3% false positive rate. We have a 6.1%, according to Tennessee Health Department, positive rate on our testing. If a lab, which there's multiple labs, but one lab admitted they had a 3% false positive rate. Now, you're not required to do a validity test in research and prove that your PCR testing on these tests they're giving people is actually valid. I just showed you that another virus causes the exact same symptoms that coronavirus can. Now, we have had an increase of 5% in the overall expected mortality through March to April. So there was more people dying. I'm not discrediting that. What I'm saying is the entire picture is not being given to us. We are not being told the truth. And if 3% was the roughly false positive rate, then it could mean that 50% of the positive cases right now in Tennessee are nothing more than false positives. That's why you see professional baseball players positive one day, negative the next day, positive the next day, negative the next day. Back and forth, back and forth. Same thing with the NASCAR driver, all that. So trivalent influenza vaccine in women, adverse fetal outcomes. This one at age 24 weeks. Mothers were administered the vaccine and placebo during pregnancy and gestation at 20 to 36 weeks. The findings were Neither was the vaccine efficacy demonstrated when the analysis restricted infants or mothers who were exposed to influenza season. We did not find a beneficial effect of the vaccine, the trivalent inactivated influenza vaccine during pregnancy on fetal outcomes. This was the Gates Foundation African study on pregnant women. All of the vaccine effectiveness markers were negative, including fetal death, preterm birth, low birth weight, small for gestational age. Every one of them. If you have a negative vaccine effectiveness, it increased the risk of all of those conditions. Yet at the end of the study, they gave the placebo group, they used a saline placebo in the study. At the end of the study, despite everything in the negative, they gave the other group, the moms and babies, the influenza vaccine. Everything was negative. There was 0 positive results. And yet the researchers still conducting the research still gave the vaccine. Now, a lot of the data analysis is not done by the same doctors who are injecting the vaccines. So again, the doctors who are injecting the vaccines on ground level with the patients may not have known that the data actually showed that their vaccine, because they didn't know whether the vaccine was there or not. At the end, they were told, well, these are the mothers and children who didn't get the vaccine actually, so go ahead and vaccinate them now, and they did. Association of Spontaneous Abortion and Inactivated Influenza Vaccine, H1N1, 2000, yeah, you can read the titles. Among the women received the H1N1 containing vaccine in the previous influenza season, the odds ratio, adjusted odd ratio for 1 to 28 days, spontaneous abortion was 7.7 times. The odds of having spontaneous abortion. Population-based cohort, under-vaccinated. The under-vaccinated had children who were under-vaccinated because of parental choice, had lower rates of outpatient visits and emergency department encounters than age-appropriately vaccinated children. So if you don't want your child to go to the emergency room, if they're under-vaccinated, they have lower risk going to the emergency department. Comparison to HPV vaccine prevalence, or HPV prevalence in those vaccinated and unvaccinated, higher prevalence of high-risk strains in the vaccinated group versus the unvaccinated group. Pilot study, measurements of autism, ADHD, asthma, allergies, that's just the A's they went through, and many others. Pretty much every single measure except for a few were on even. Not every single condition, but a lot of them are. Because the immune system is one of the primary systems of your body that control and regulate. Like it's like your nervous system, get adjusted, and take care of your immune system. The biggest 2 systems of your body that will disrupt everything else. The measles vaccine, I've seen online newscasters, online or TV doctors who are supposed to be promoting vaccines and safety and things like that, promote this as, this study went through millions of children and found 0 risks. They actually referenced this and cited it, just like the CDC did when they cited that report that said you can't say vaccines are safe. The design and reporting of safety outcomes in MMR vaccine studies, both pre and post-marketing, are largely inadequate. The evidence of adverse events following immunization with MMR vaccine cannot be separated from its role in preventing the target disease. Again, it prevents target disease. Measles, mumps, rubella can be reduced by the MMR vaccine. But if I kill your child, cause them to die before they have the opportunity to get measles, then I can statistically say it reduces your risk. So does a 9mm though too. You can't die of cancer, you can't die of heart disease. A 9mm can reduce the risk of dying of many, many different things. It's all in how you do your analysis. It's all in how you question and label effectiveness, okay? But again, that's a design and reporting outcomes, MMR studies, pre and post marketing, largely inadequate mortality rates. This is what I think parents need to see. Infectious disease keep delivering surprises to the US, all right? Overall mortality, all-cause mortality in dark brown, infectious disease mortality here, all right, in this light yellow, and then all-cause non-infectious disease mortality here. So you combine the brown and this one, that's where what equals this line, but pay attention to this line right here, okay? Wide-scale vaccination initially started. They did diphtheria vaccines and tetanus vaccines in very small isolated groups. The way they used the diphtheria vaccine originally was not to give the diphtheria vaccine to everybody in the 1930s when it was invented and brought to market. They used it when there was an outbreak, and they would basically do a cocooning, where they would basically vaccinate people around them, maybe contacts and things like that. But again, they did not do anything wide scale. This is very, very minimal. But wide scale, when it was introduced for all children born in the US to get the DTP vaccine, that's when they initially started doing it to everybody. It was in 1948. 1955 was the polio vaccine. 1963 was the measles vaccine. Pneumonia and influenza vaccine started in 1977. Do you see the rate of infectious disease deaths go down after those vaccines? We plateaued. This is the trajectory of infectious disease mortality, going rapidly down before we implemented wide-scale, nationwide, all your children get vaccinated. After the vaccines, it leveled off. I have more evidence with this one study right here to say that vaccines actually cause a distortion in your immune system, causing an increase in infectious disease death. Because the rate of decline, statistically, you should have been able to see it. I'm not saying that's exactly what's happening, but when you study the DTP vaccine in third world countries, it does increase the infectious disease mortality rate. It's one of the primary reasons because it distorts the immune system. But again, this didn't change. Another one, Journal of American Medical Association. That was when pneumonia vaccine started in 1977. What do you see there? They snip that out. They literally take this big old graph right here, pneumonia and influenza. 1977, we started implementing small-scale influenza vaccines for elderly patients. Pneumonia vaccines were more widely implemented, and again, not nationwide, everybody gets it, but as soon as that occurred, what do you see happen after the vaccine? Slightly went up. Again, diphtheria, tetanus, pertussis vaccine, polio vaccine. The spikes in polio were before the vaccine was available, and it was on a decline anyways. The moth and the iron lung, if you wanted to read about the polio one, lots of deception in polio. Lots of deception. We have more people suffering with paralytic diseases today than we ever have before in history. When you incorporate transverse myelitis, ADEM, that's acute disseminating encephalomyelitis, meningitis, paralytic meningitis, when you include non-polio paralytic disease. In India, you see tens of thousands of increases in non-polio paralytic diseases, but a decline in acute flaccid polio. So polio went down, but non-polio paralysis goes up. We're not preventing paralysis with the polio vaccine, we're preventing a diagnosis. That's what we're doing.
I have a question.
Yes.
Can you go back to the previous slide?
Yep.
And do all the things? Got it. What year was the first one?
1948. DTP vaccine.
1935.
1935 was when the diphtheria vaccine, and then is that what you're talking about?
No.
I believe it was around that time.
What happened when it started declining?
Right here or in here? So in 1900?
Nope.
1935 right here?
What happened there? It's obvious that there's an extreme decline.
Like the extreme decline prior to. 1999, I have this in later. There was 1999, I had Journal of Pediatrics. States that the wide-scale use of sanitation, not dumping buckets of poop in the streets of New York. New York was one of the highest areas for polio, all these infectious disease deaths. It was like the primary hub of deaths for infectious diseases because they had multiple people living. I mean, it was just horrific. Health departments did good back in that day because they required like sanitation, no more than so many people in a room housed together. Like it was close to like full-on slavery and just poverty and horrific living conditions. That was the reason. And they say it was prior to vaccines and antibiotics, they saw the largest decline in infectious disease mortality before vaccines were even available. So, yeah. Because at first I'm like, trying to think of when the diphtheria vaccine exactly was. Yep.
Publicly and in health.
Yep.
And hand washing.
Yep.
That's what started the decline.
And you look at like hand washing, I forget the gentleman's name who was jailed for saying that hand washing could prevent maternal death while in labor. Because doctors would go from cutting up cadavers and studying bodies to, going and birthing babies and yeah. And so I always say this, watch this. So 1917, I believe it was, when sliced bread maker, the first machine sliced bread maker was invented. If you're going to cause something, you have to do something. If I go home tonight and I walk into the spick and span spotless house, and I go to the couch and lay down and be, babe, can you make me dinner and get me a drink? I'm pooped. I cleaned the house. It was dirty when I left, but when I got home, it was all clean. So I did it. That's what they say. This is the way they tell people, and this is a lie. It's a truth, kind of. Look at all the people prior to vaccines dying from infectious disease. Before vaccines, thousands of children died from these infections. After vaccines, hardly any dying from these diseases. That's a true statement. But that's how they get people to believe that vaccines did it. But when you put it like this, you're telling me vaccines caused this when that was when the vaccines were implemented. You get me? For candy, I guess, or chocolate, again, it's healthy. It's kind of healthy. Where is it? Oh, you got it. Okay. How many, the 4 years prior to, and I know probably nobody's going to get this, but 4 years prior to the measles vaccine being implemented in 1963, how many cases, on average, if you take the 4 years prior to 1963, before they had the vaccine, what was the average number of children who died, or anybody, not just children? Children were a portion. How many people died on average per year from measles? In the nation, the U.S. No, higher. Because remember, chickenpox was roughly before the vaccine, it was just around 200 or slightly less. So measles is a little bit more harsh. You're close. Higher. 400, you got it. There we go. It was roughly 401 point something when I did the math, for the 4 years prior to. Now, who can tell me how many people, let's see if I can find it. But it's in here somewhere, we might get to it, maybe not, doesn't really matter. But if you look at the FDA and research studies, PubMed, how many people die on average every single year from taking Tylenol?
A lot more than that.
Now, a lot more, but according to acute liver failure, just acute liver failure, that one diagnosis also can cause kidney failure and other things, and it increases your risk of infectious diseases. Every single study ever done in humans and animals, you shave the hair off a ferret, you will increase the risk of the ferret dying of a fever, dying from an infectious illness. Higher fevers with measles actually had an association with better survival rates. Fever is what your body uses. It actually stimulates the production and output and function, improves function, efficiency, and production of your immune cells. Pretty amazing. But medicine says take a fever reducer. If you don't give a lamp to a lizard, you will increase their risk of dying from an infection, and these are controlled trials. Every animal, every human trial ever done, you reduce a fever, you increase your risk of dying from an infectious disease. I hate to see children suffer, but I'm telling you, I would rather see my child suffer through a fever than die at my hands because of something that I did. So not only is it acute liver failure, but it's also infectious diseases, all right? Did you know that roughly they're saying that millions of additional people come down with influenza and thousands of additional people die from influenza every single year because people will take a fever reducer and then go to work, send their kids to daycare, send their kids to school, everything else. Now they're waving that little magic wand across your forehead before you can go in and eat and dine in all these places with fever reducer. So just take a fever reducer and you can bypass that little wand that they want to wave. Nope, I'm good, but and still spread an illness. So if they really cared about reducing transmission of infections that could cause the loss of life, why didn't they, when they had all this research, why didn't they stop the use of fever reducers? Do you follow me? If they truly cared, they should be doing that, should they not? Now, I don't believe in government overreach. So if you want to take a fever reducer, I believe at least you need to have been given the information to inform consent on whether you want to take it or not. But if you still want to take it and increase your risk of dying, go ahead. I don't think the government should say whether you want to or you're allowed to or not. But then you could also question, why would somebody be allowed to sell something that has it has therapeutic value, but no survival value. All those references were from 1900 to like 2000. This was death rate from scurvy. Follows basically the exact same trend. What is that reference? Nutrition. As nutritional deficiencies go down, the death from nutritional deficiencies went down, so did the death from infectious diseases. I could go through Ukraine as well, same kind of thing, all right? This is Diphtheria Vaccine, okay, happened way back here, so you can't really reference it too well. It was already on the decline, but again, you could argue probably the best of vaccine effectiveness, but again, it's arguing that it reduces the risk of diphtheria death, but does it mean that you have a better survival? You have to measure that. If you don't really get an assessment of the value of a vaccine. So, but if you go through all of these things, again, that was tetanus, that is pertussis. Pertussis vaccines reduce symptomatic illness, but actually increase transmission. And I could go through all these studies. If you go, like all these. One of the biggest ones I want to show you, that was the one. Again, I think this is the BCG. That was, BCG was already in decline. That one is it's tuberculosis. So it's the diamond one here. BCG did nothing. This is BCG. This is BCG vaccine given way back here, did nothing. There's the rate of mortality. You look at the polio vaccine is here. Yes, it did decrease, but it spikes back and forth despite the vaccine being there. And they did show that the death from these illnesses could be reduced. But again, it's from those illnesses. It's not all-cause mortality because they went to war. When they went to war, what would happen in war though? Poor nutrition, not so much good living conditions, more stress, all these things. So yeah, you're gonna have higher mortality rates. But you could go through that. What happened with hepatitis B after that? Went up. Go through all those vaccines. This was an interesting question that I had here. That was when the first measles vaccine was implemented. What do you see happen to meningitis? What do you see happen to acute upper respiratory infections? Go up, go up. Do you know that encephalitis, meningitis type symptoms can be caused by the MMR vaccine? And that's in Ukraine, so I can show you multiple countries. A national and state profile leading health problems, healthcare quality in U.S. children, an estimated 43%. So this was done 2011, an estimated 43% of U.S. children currently have at least one of 20 chronic health conditions. That's 43% of our children have one of 20 different chronic health conditions. They say that it's roughly 19%, all right? 19, when you add obesity, it's 54% chronic health conditions. They say when you add all of those up, right, in 2011, it's worse now, it was 1 in 5 children have a chronic health condition in the United States. Okay, so back in, this was published in 2010, but when you look at the study references, 12.8% had this in 1994. 12.8% of US children had a chronic health condition in 1994. And in 2011, it's over 50%. Are we going in the right direction, folks? Hepatitis B vaccine was licensed, not used on a wide scale, implemented in childhood schedule right there. What happens to hepatitis after the vaccine was implemented in the United States? And again, just like Ukraine. I could go through, these are government, this is National Ambulatory Medical Survey and the National Hospital Ambulatory Medical. These are government websites that these graphs come from. Again, hepatitis A vaccine, hepatitis B vaccine. Hepatitis A wasn't mandated until later. I'll show you that. So I'm gonna kind of scan through these quick. Watch this. 1994. What do you see to diabetes? Go right after that. Roughly 3 years after that is when it started to go up dramatically. That was in the vaccine for hepatitis B, clustering of type 1 diabetes, autoimmune condition, roughly 24 to 48 months after hepatitis B vaccine in infants. They see a clustering. How long was the hepatitis B vaccine? Cirrhosis, liver, cancer have all gone up dramatically. That's what hepatitis B vaccine is supposed to prevent. The hepatitis B vaccine insert, if you actually read it, 3-dose regimen versus the 2-dose regimen, children were followed for 5 days. They received this and just the vaccine or CombiVax, and 147 children, infants and children, who were then followed up to 10 years of age. When did they give the hepatitis B vaccine? You get a piece of chocolate if you know.
Right at birth.
Right at birth, okay. Somebody else said it first, or around the same time you did. You get the chocolate though, okay? So, or just throw it out there and let them all have it. Fight over it. 5 days, 5 days. That's how long you had to monitor. But guess what? If you study vaccine safety studies on the influenza vaccine, if your child or spontaneous abortion occurred within the first 14 days after you got the vaccine as a pregnant woman, your child was eliminated from the study. You and your child were eliminated from the study because the vaccine supposedly doesn't take effect until after 14 days. But the hepatitis B vaccine safety trials only followed children for 5 days. And those are all different conditions monitored. Hepatitis B A vaccine followed 40 children with zero, they tested their blood, zero autoantibodies. I think it was 10 children came with autoantibodies. At 12 months, it resolved to only 2 children maintaining autoantibodies, including autoimmune thyroiditis, Hashimoto's disease, one of the most prevalent conditions in the US right now today. Again, children healthy, given the vaccine, 1 month later, test their blood before the vaccine, no autoimmune disease condition, and autoantibodies. They say that at 12 months, these children didn't have any signs of autoimmune conditions. They've monitored people's blood and seen that autoimmune conditions or autoantibodies can be in the blood for up to 10 years prior to any symptom of lupus, RA, MS, and many others. But they said it still seems like the vaccines are safe because none of the children within 1 year came up with any symptoms of thyroid problems or autoimmune disease. Well, their level of healing and regeneration is greater than their level of tissue destruction. So they didn't have symptoms yet. Brief report, lupus, an unrecognized leading cause of death in young females. And those antibodies were increased by the hepatitis A vaccine. Here's another way they deceive you. Incidence of hepatitis A. This is the CDC's website. Started in 2006. That's when the vaccine started. Look what happened after. Isn't that amazing? Our vaccine works. But wait, don't dig too deep into the NIH website because that was hepatitis B. Shoot. Did I not get it? There. So this is all hepatitis. Hepatitis A, I'm sorry. Hepatitis B, or A was licensed in 1995 and then implemented in the childhood schedule in 2006. What happened before the vaccine was available? But that's what the CDC shows you. Is that honest? You get me? Sorry about saying that again. Hepatitis A is on the rise. We could go through autism, infantile autism. They used to blame, it was a 0.7 cases of 10,000 children. This is where the 1 in 10,000 cases come from. These are government statewide research studies. There's another doctor who's a whistleblower as well, who worked for, I believe it was the health department in Iowa, doing research on the prevalence of autism. And she said, we're making mistakes. Why have we been seeing autism rates go up? And now we're excluding cases. We can't do that because we're not appropriately assessing autism. She started to redo the research with her colleagues. She was hired by the CDC. All right? She's won a lawsuit for wrongful termination. She has not proved in a court of law that the science has been fraudulent. But her issue for being fired was that she was unwilling to continue on reporting autism rates the way they were trying to make her report them. So they fired her. So she won a lawsuit for wrongful termination because they didn't have grounds to fire her because she didn't do anything wrong. And that's actually a Dr. Zimmerman as well. So there's 2 Dr. Zimmermans. 2 different people, one with the omnibus autism proceedings and another one for covering up Iowa's rate of autism. You go through that, you'll see the rates of autism have gone up. It's not better diagnosis. Vaccines are not associated with autism. And evidence-based meta-analysis, looking at tons and tons of research, supposedly. You read it. Now, I put this up there in this PowerPoint because DiStefano and William Thompson is the CDC scientist who confessed to committing fraud. So I've already talked to you about that. They started out, identified 929 research studies in PubMed. And used in the analysis was 5. $929 different pieces of research and clinical or scientific evidence in the peer-reviewed literature. And they only wanted to include 5 when they said vaccines don't cause autism. It's a joke. We recognize that now, they eliminated all VAERS, Vaccine Adverse Events Reporting System. This is another ironic thing. So, the researchers said we eliminated VAERS because it's a voluntary reporting system, which is always an under-reported system. So the real rate is far higher than it's reported. They said we eliminated it. We recognize that there does exist data in VAERS that report positive results of autism caused by vaccines. However, due to the aforementioned reasons, these papers were excluded. But for parents who do notice significant changes in their child's cognitive function and behavior after vaccination, I encourage you to report these events immediately to your family's physician so they can report them to VAERS. But we won't use it. So literally they say in the study, we're not going to use VAERS, but report it to VAERS, where we don't use that information to establish or even assume a causal relationship. Do you see how they literally spit in your face as parents? I could tear apart. Here's one, the CDC science on this stuff. Again, fraudulent researchers. Frank DiStefano was a co-author with William Thompson. Increasing antibody-stimulating proteins and polysaccharides. Polysaccharides are multi-sugar chains. They're a long sugar chain. Poly, many, saccharides, sugars. Found in like mushrooms and vegetables and different things like that. It's typically sugars your body can't break down. But antibody-stimulating proteins. So there's proteins on the surface of viruses. Oftentimes there'll be an enveloped virus. They have proteins on the surface. They'll take those proteins and use them as the antigens to activate your immune system and train your immune system to identify measles, mumps, rubella, polio, or any of those other viruses they said they're using or they're trying to vaccinate you against to protect you from. But those proteins are what God made your body to come in contact with. So even though we have more vaccines, way more vaccines, we have more autism, we have more vaccines. So if you wanted to ask the question, do more vaccines, is that rate of increasing vaccines associated with the increasing rates of autism? Yes, it's simple, it's straightforward. But no, let's take something that we know for a fact has declined in vaccines. They use less of the measles antigen in vaccines these days because they use more adjuvants. Adjuvants are things like aluminum, which are added to vaccines to hyperstimulate your immune response, and aluminum alone injected is known to cause autoimmune conditions. HPV vaccine associated with autoantibodies to your brain, many others. So they knew. This was established, one of the authors or the assistants to this was Paul Thorson, it was Paul Offit, all right? But they knew antigens went down. That's something they knew for a fact. So they measured what was in a vaccine that they knew went down, and as it went down, autism rates go up, so vaccines don't cause autism. But I can show you studies, aluminum adjuvants, that went up. If they just chose adjuvants over antigens, then the research here would have shown that vaccines are associated with autism. Why choose one ingredient, though only one ingredient that actually went down in the amount that's being injected to our children when everything else seems to be going up? Do you get me? They're smart. This is a peer-reviewed science. They asked the right question. They knew what they would get. More studies on acetaminophen, which is a mitochondrial liver toxin, and aluminum in autism, aluminum in the brain tissue of autistic children, higher amounts of aluminum than even Alzheimer's patients in children with autism. Association between influenza infection and during pregnancy and autism spectrum disorders, vaccination or the infection. So, would you rather get the infection, if you don't want your child to have brain damage and autism, would you rather a child have, and Rachel, if you gotta cut me off, I literally told you guys I'm just gonna crash course.
5 minutes.
Okay, so findings could be due to, okay, so there was no association between maternal influenza infection anytime during pregnancy and autism. There was a suggestion of an increased autism spectrum disorder risk among children whose mothers received the influenza vaccine in their first trimester. That's Journal of American Medical Association Pediatrics, folks. And that was published in 2017. This is not rogue science. Safety of thimerosal, that's the mercury preservative that has been filtered out to only trace amounts in vaccines, has been found associated with autism. IL-4, this is your immune system, all right? So there is a court case I'm going to show you real quick. So ICANN, Informed Consent Action Network, filed a lawsuit against the CDC, and I believe it was the CDC, requesting any scientific evidence they have to show that vaccines given to children before 6 months of age, do you have any science, the DTaP vaccine, the Hib vaccine, the Influenza vaccine, which is at 6 months, that show, one of which was the Combavax Energix B, so that's a hepatitis B vaccine. I highlighted it specifically because let me go back, make sure. So they filed a lawsuit. CDC, reference studies, 0 scientific studies, 0 showing that the vaccines given to children under the age of 6 months do not cause autism. The CDC has admitted that. They had to file a lawsuit to get that. They are spending money for lawyers to literally force legally the hand, even though they file a FOIA request, the CDC will just sit there and do nothing until they file a lawsuit. And then they have to admit it.
And then, so say it one more time, that vaccines prior to the age of
6 months. So any vaccine given to children before the age of 6 months, the CDC has, through a FOIA request and a lawsuit, recognized and handed over 0 scientific studies that they have in their possession that show that those vaccines do not cause autism. So if they claim vaccines don't cause autism, they cannot. They have legally lost the ability to do that.
So do they think that they legally have scientific verification that it does not cause autism after 6 months? Like, what's the differentiation?
So they have MMR vaccine studies.
Okay,
Again, Paul Thorson, thimerosal, mercury-based preservative, they have some of their studies. Again, Paul Thorson, CDC scientists like William Thompson, admitted that the MMR vaccine study that he took part in that said vaccines don't cause autism, the man confessed, we tried to destroy the documents.
But they just haven't done documentation on 6 months and younger.
Yep.
Okay.
No studies that they have in their possession, but there are studies, because watch. So IL-10 or IL-4 is an immune cytokine, okay? It helps to regulate your immune response. Mediates delayed neurobehavioral impairments induced by neonatal hepatitis B vaccine that involves the downregulation of IL-4 receptor in the hippocampus. Very simple. It distorts your immune system. In rats, they study this and they watch the cytokines that are involved in autism. IL-4 increased at levels of IL-4 in the brains of autistic children, okay? This study in hepatitis B vaccine was published, trying to look for a year. Maybe I don't have the year on here, but it was fairly recent. Yeah, I don't have the year right here on that picture. But what they found in this animal study, day 1 of birth in these rats, or mice, whatever you want to call them, little rodents, they vaccinated them with an equal dosage according to their body weight with the hepatitis B vaccine they give to humans, to babies. What's that? They did their body weight. So they brought the dosage down to the body weight that would be similar to the body weight and dosage that they give to a human being. They watched immediately an alteration in the immune chemistry of the brain. Here's the interesting fact. These rats did not show any psychological or social behavior abnormalities until roughly 8 weeks of age. Why is that significant? When do most infants begin to show signs of psychological, neurobehavioral, developmental delays and regression? 18 months. What if 8 weeks in a rat's life is similar to 18 months in a child's life, folks? There's more evidence to prove that vaccines cause autism than there is not. And especially when you throw out the science that is published by researchers who are OIG fugitives, who've confessed to committing fraud. When you throw that stuff out, the CDC has nothing to stand on. It's just their censorship. They're continued lies. And that is wrong. And that's why I speak up. That's why I do what I do. Go ahead.
How did autism come to be, like, prior to vaccine? Do we even know there was such a thing? What did they call it?
So
And
there,
did it exist before vaccine?
get this book. Forrest Meridia goes back. I'm actually, so I'll read books and then I'll read the research. So, like, I don't have, this guy, he goes through, like, one of the first autism cases written up in any medical literature was like in 1931, and the diphtheria vaccine started in like 1930, now that I say that.
Where did the term autism come from?
Autism?
Why is it called that?
I'd have to look that up. Why that? That's just something that never's really intrigued me, why autism is the name autism.
Yeah.
I've never looked it up. But there was never before in any medical literature, and even the guy who recognized this child that had autism, who was vaccinated, the
So-
diphtheria vaccine, he literally said, I've searched the peer-reviewed literature, I can't find any evidence of a similar neurobehavioral condition.
Except by vaccine.
And he didn't necessarily, he just mentioned that the child was vaccinated, but
Yeah.
it didn't, and it's the same, it's a year after when the first case of autism was represented in the peer-reviewed literature.
It really took hold way later
Yeah.
when it started
Mhm.
all these
Because again, the diphtheria vaccine wasn't used nationwide in every child. It was used to kind of, we had an outbreak of diphtheria, let's rush in vaccines and vaccinate all the kids that were at that daycare. That's kind of the way they used them.
You said something about schools that are funded by the government won't or can't accept.
They can't refuse admission for religious, they're trying though, they are trying. And so I don't have any books on that. I've never really thought to seek that. I've just kind of sought my own, like through biblical and just looking at it. That's kind of like the golden calf in the Bible was a cow. So to me, vacca, granted, I tell people like, I don't know. I don't really remember the friends that I lost due to this discussion. But I have more people that hate me and dislike me. I have atheists that I love and will witness to and can talk about Jesus Christ with, who will not disown me as a friend. But I have Christians who have disowned me as a friend because of my stance on vaccines.
But they've never actually listened to you.
But they've never, yep,
Listened to you or read an article.
yep. So.
Are you following the current study of the vaccine for?
The coronavirus one, well, coronavirus key, if you look through the research on they've been trying, this study, look,
Been trying for a long time.
yeah, like 10 years.
More than that.
All these coronavirus studies prior to in animals, they skipped animal trials with the new coronavirus vaccine. I'm sorry, SARS coronavirus 1, you already attempted to make a vaccine for it, and every single animal study increases eosinophilic infiltration. If you look up eosinophilic diseases have all increased over the years. It increases especially in elderly rats and mice, what is the population most at risk of coronavirus? It's the elderly, all right? Increases infiltration of immune cells that cause inflammation and cause pneumonia. So rats that got it, fought it off, it was a harsh illness, and then they get reinfected, can fight it off again, some would get pneumonia, not all. Some would have eosinophilic, but far fewer would have eosinophilic infiltration if they were naturally infected first and then infected afterwards. You can't do this in a human trial. So in the animal studies, they vaccinate or don't vaccinate, naturally infect. The vaccinated rats had higher mortality and higher rates of inflammation in their lungs and death.
The herd immunity is better.
Yes, in a way. But herd immunity doesn't matter for things like coronaviruses, for things like, and they might to a degree, but in my opinion, when I look at it, we're always going to be faced with infectious illnesses. There is no way around it in this world, okay? We're not going to eliminate all these things. It comes down to how you take care of your vessel. That matters. That's the only thing that's really going to matter. Because again, people can asymptomatically transmit various different viruses. Not going to argue whether they can or can't with coronavirus. But what I'm going to say is it comes down to the individual's health and strength. All right? So, any other questions?
You sign that religious form, did you put "get me" at the end after you said "God is my witness"?
Get me? No.
Should have.
Why is that?
Get me?
That's what you said.
Oh, you get me?
There you go.
You better get me on this.
Copyright that.
Yeah. I mean, it's like, it's just sad. Like one of the things, just watch the differences. So when I went and spoke in front of our Tennessee Committee on Health, when they were approving the promotion, not the force, of the influenza vaccine for children in schools, where then schools promoted as if it was a mandatory vaccine for school admission. That's the way they, and the health department assisted them in telling parents a lie. The health department's spokesman, the pediatrician, got up there. Vaccines are safe and effective. They've reduced all these. Again, I showed you JAMA and all these studies that show that that's not true. If you look at all-cause mortality in infectious disease mortality, vaccines didn't cause a decline. It just stayed level after that. He said nothing of research. And when I walked up there, and it's on my YouTube channel, I think it's like Father Pediatrician Flu Vaccine in Congress. If you Google that on thewilddoc.com, you'll see it. I read in 5 minutes, like research study, research study, research study, research study, research study. And I literally said, with a research study, I quoted them and I said, thus children who are vaccinated will have an increased risk of severe illness and mortality, death from influenza if they're vaccinated. It's a research study. I said that to him and I said, if you approve this, you will see happen what you're saying you want to prevent. I literally said it something like that. So they held off on their vote that day, where the pediatrician spoke and I spoke. And I said, I'm a father, and I brought the research, and I said, as you can see, this man didn't bring a single bit of research. I pointed at the pediatrician. Afterwards, the American Academy of Pediatrics spokesperson, the guy that brought in the pediatrician, who's like the lobbyist, comes up to me, grabs my arm. Don't ever come up to and don't ever threaten my pediatricians like that. You are so rude. That is unacceptable in that room. I'm like, I read research and I just wanted to point out the obvious, and I was a little bit passionate about our children. I'm sorry. Had a discussion. Anthony still got video we never posted because that guy, the AAP lobbyist, who's lobbying for vaccines, admitted us on video that his daughter doesn't vaccinate her children. And he then took all his money, didn't fund her college tuition after that. He admitted all that to us on video, didn't he, Anthony? So then they tabled the vote, didn't vote that day, said we'll vote next Wednesday. So I came next Wednesday, shut down my office to do so. I lose money because I talk about this. I got there, sat dead center front row. There was one lady in that committee of 10, I don't know how many state Congress members they had. Let the health department speak, and I'm thinking, I'm gonna get to speak again because I'm the one who spoke and brought all the research. Health department stood up there, didn't give a single bit of research, none. I quoted from the research studies. I quoted from CDC studies. The chairman of the committee says, does anybody else here have anybody else they'd like to speak? Sit in front row. I'm like, I'd like to speak. Here's the lady that was on our side to a degree. Afterwards, she said, keep fighting. I'm sorry. But she looked at me in the face as we're waiting for somebody to call on me. She looks me straight in the eyes and goes, I'm sorry. Says, I'm sorry. And they approved it. Guess what happened the next year?
Exactly what you said would happen.
Exactly what I said would happen. Highest number of children, 244. Highest ever reported number of children dying from influenza and pneumonia. I told them it would happen. So wrong. And you got to think about this, folks. That Congress member, that lady, lipped. I'm sorry. The chairman asked, does anybody else have anybody they would like to speak? You know she wanted me to speak. But they had backroom visits with those pediatricians in the health department before the meeting with the public and the parents. You don't think our government's corrupt? Wake up. It is unreal what's going on. And some people, so, sorry. Woosah! I mean, it's just, and people ask me, Dale, and I'll see people like Dell and others say, we're winning. People are waking up, but things are going to get worse. I'm a Christian. I believe in the Bible. We're not going to win these battles. There's going to be a lot of suffering, a lot of bloodshed, a lot of heartache. We will flee from town to town. Folks, it's kind of like, get ready for it. I'm hoping we get a little bit of an intermission before that so I can enjoy family time with my family. But the reality is I'm also prepping and saying what happens when that day comes. When it's deny God or be sacrificed, be killed. I don't think we're going to win it. We're not the ones that are going to win it. God's going to win it. So please, if you don't know him, get to know him. All right.
Thanks, Dr.